Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today we're going to show you the Ultherapy procedure. This is still actually my favorite procedure for skin lifting. It's the only one that's actually FDA approved for skin lifting. It's completely non-invasive, so there is no recovery time at all, outside of just being slightly pink for maybe the first 15 to 20 minutes. And we can usually see some immediate lifting and tightening right after the procedure from the tightening of that fibrous connective tissue. And then over time, it also builds new collagen in the skin, so the results continue to improve. For usually 4 to 6 months and even up to a year, you can see continued progress in the sense that you age backwards for some time. So it's really nice. And then for maintenance, you can repeat this procedure maybe every 3 to 5 years. If you wish to, some patients do come in sooner, like maybe yearly, just to kind of give themselves a boost and to make sure everything stays nice and firm. So to get started with the procedure, I'm going to just mark out areas of her skin that we're going to treat, and our focus today is the lower face, the submental area and her neck, and also the under eye area. We can of course also treat the forehead to get a lift in the brows, and then I also enjoy treating the lip area because it just kind of gives a little bit of a natural lip lift. And then under the eyes, it's going to help tighten that loose skin. The under eye skin is thinnest on our body, and it tends to just show age a little faster in most patients. And other treatments we use in the under eyes are like dermal fillers, sometimes a little bit of Botox. But you know, the first thing we want to accomplish is just tighten that skin as much as possible. So I'm just kind of outlining the areas that we're going to treat here. So we're going to start the procedure now that I've marked the patient, and I'm going to have you just lift your chin up a little bit for me. I'm going to start in the submental area. This is a little bit of the ultrasound gel to help with the transmission of the ultrasound energy. So this is a high intensity focused ultrasound. That's what we're using. And so it sends a direct beam of ultrasound right under the skin. And the patients do feel it a little bit. It feels kind of hot, and but it's just very, very momentary, and there's no discomfort after the pulse is over. So first, I'm just actually looking to see how deep I am, and that seems to be just perfect. So we're going to go ahead and start, okay? And I'm just moving it very, very slowly, almost imperceptibly, up this row. And each time I'm firing, it's creating a line of little ultrasound beams under the skin. Almost sounds like it's zipping up all that tissue together. So this first pass is more aimed at the connective tissue, what we call the SMAS, which is normally sutured during a facelift. So during a facelift, the skin would be elevated and then sutures would be placed on the SMAS. With the Ultherapy, we can find the SMAS with the ultrasound and put the lesions directly on the SMAS, forcing it to shrink almost like you're getting a suture in that area through a facelift. So that's what makes it the most, in my opinion, like a facelift. And the second pass will target more of the collagen, but first we are targeting that deeper smaz right now.